Consider, just in general, for the cervical region, that we have an anterior distribution. We have a distribution that goes laterally, particularly at the very top. We have a posterior distribution, and there's potentially posterior distribution, and then there's potentially a distribution right along the spinous process. So we have a median posterior, we have a lateral posterior. We actually have a couple in the very bottom that are lateral points. And we have anterior points that go all the way from the sternocleidomanubrial junction all the way up the front of the neck. And even one that's in the jaw.
Can you show the posterior once more for the camera?
Oh, this side?
Mm-hmm.
Don't forget to smile, Cheryl. Here's the posterior ones along the lateral mass of the muscles here. And then there's the median posterior right up the spinous processes of the neck. And that reflects that the neck has anterior function, lateral function, posterior lateral function, and pure posterior median function. We're going to start with a really simple one. And where I am is kind of at the intersection of a line drawn down from the earlobe and a line drawn back from the angle of the jaw. I'm not up in the crease of the jaw under the ear. That's the atlas. It's actually an atlas point that we're to explore. Just to give you a simple demonstration, but I'm one segment below that. So I'm right by the jaw, right down from the ear, laterally. And that's the point.
Ooh,
That's the point there.
Is there C1 point?
C2 point.
C2.
Yeah. And it's, or there. Sore? Either one?
Yes, this
Which
one is more sore.
Yeah.
So it's not right on that angle. It's right on
No,
the
you're not off the. You're off the bone. Here's the angle, and we're gonna explore these really soon. But I'm in the soft tissue.
Okay.
If you imagine a line drawn down her neck from her earlobe, and a line drawn back from the bottom of her jaw, where they intersect, behind the corner of the jaw, not in the corner of the jaw. You're over the transverse process of C2. And because C2 is purely rotational, and C2 is the key player of the CVJ, and C2 is a mediator of dural tension between sacrum and cranial base and cranial diaphragms, C2 is extremely important in whiplash cases and mediating shifts in STDS and the restoration of health to the dural tube, to our membranous sacrum. Right? And since C2 is, where does all oh, it's all right. C2 is responsible for 75% or more of all neck rotation. Remember, C2 has that long odontoid process. It serves like a pivot rod, and it pivots around it. So nearly all of the neck's rotation happens purely by C2. So what I'm going to do is, I know that if you've got a tender point there, which is pretty sore, huh?
Yes.
Because of the soft tissue here, I'm going in a little bit deeper, but I'm going to the extent that it feels, and you can feel a kind of emptiness, a kind of deadness there that's not on the right side. It's kind of a little bit sore. And the treatment is simply going toward, wrapping toward the point. I'm going to use my other hand now to come underneath and grasp the point from below. And I'm just going to introduce pure rotation. And feel the point. If this is what's needed to treat the point, the tenderness will all but disappear. How's that feeling?
Still a little tender, yeah.
A little bit, but shifted, right?
Too, yes, better.
But what I can feel is that she's got a lot of muscle tension in her head that's not letting me get as far as I want to in pure rotation. So what I'm going to ask her to do is push into my hand and release.
Oh,
How's that now?
better.
Yeah.
Oh my gosh.
No, that's something I introduced myself.
That's the strain.
Yeah, really. Yeah. And then because of what's going on with her, the rest, this front part not releasing in, I'm going to have her push her ear into the table. Good count of 6. And release.
She's pushing while you're also following her force.
So your underhand underneath, your right hand is on the point.
Yep. My third finger is on the point reaching
Okay.
through. It's hard for me to do that with my other hand, the hand that was feeling it initially. So I have to switch hands.
Right, that's, so just
Yep.
clarifying, because I can't see
Yep.
it. And you just allow, you're feeling that point, and then you straighten.
So then what I'm doing is a contract, relax to activate all the muscles that would resist her from getting into the position. So if her right rotators were really tight, then I'd have her push into my hand away from the trigger point, from the tender point, and then release. And notice she goes a little bit further. And now her flexors are tight. Sorry. And so I'm asking her to use the opposite muscles. I mean, tighten down. I could ask her to push up to the ceiling. Push up to the ceiling if you want. I don't find that as effective for some reason.
Like
So
push
in
your
the-
ear into the table.
Yeah, push your ear straight into the table. And that relaxes her flexors immediately.
Yeah.
And that's the way the nervous system's wired. If you use one set of muscles, its opposite muscles will be relaxed. That's good.
So you
How's
have her do
that?
both to see which
Good.
gives her the best?
Yeah.
Okay.
I'm doing everything I can to get her to relax into the position that will give her relief. It's my job, right? All things in service of getting the tender point to disappear. And that's gone. Jones was emphatic about waiting 90 seconds. It's changed. I wait until breath and flow. Because of... Is that a sneeze? Bless you. Because of the relationship, what I sometimes will do is find myself doing a blanket from here as she starts to release, or I'll get up and put my hand under the sacrum. I've done snake from this position as well. If this brings that relationship to balance, wouldn't it be nice to give it a chance to treat, having artificially induced that balance? And suddenly you start to feel breath and flow, and there's way more stuff to treat with blanket. Or if we've got a team, if we have a team, I could go, Elaine, could you go under the sacrum? And she's under the sacrum. I mean, unit of function, right? So sacrum, C2, blanket. It's kind of nice. You see how that... The potential for this really is sweet in team healing. And then again, like as in before, we want to come out slowly and then recheck the point. How's that?
Way better.
Now, I won't lie to you. But I'm not sure how to phrase this.
But you won't tell us if you're ready. Yeah, go ahead.
Never let it be said. Never let it be said that I lied to you. Very often, you'll go to organize her, you'll find this exquisitely tender point, and you'll organize her, and she can't release enough, even with this little contract, relax maneuver. And sometimes it means that there may be several other points that need to be addressed before. Like if her neck's so tight because of other restrictions, then you might need to do other things before you can get this to release well. Now, in fibromyalgia cases and big trauma cases, both sides will have to be released.
So is, okay.
Because, again, confusion in the nervous system, and it may be if this one didn't release, it's because we've got to go over here, and that's still sore, right? So you got to go over here and come underneath you and go down. And how's that feel now? Better. And often if we tried to release this might not have released until the first one let go. So don't be surprised if you find yourself treating several points in order to get, or doing several different things in order to get one tender point to release.
So
Stephen, your hand underneath, it's on the same point as the other hand had been on?
Yes. Yeah. Thank you. Everybody clear about that? All I'm doing is monitoring the point.
So you do the most tender one first.
Tend to, yes. Now, I'm just going to throw this out because it's not uncommon. If you can't get the head to turn one way or another, and it's really sore, there is a posterior tender point at C4. And if you look, here's my finger. It's on the spinous process, and you can just grope your way down the spinous process and find the spot that'll be sore right on the spinous process, just beneath it. C3 and C4. See my finger? Might want to come around and
Oh, yes, try not to move
You
so
think
much.
between C3 and C4?
right on the transverse process of the tip, because C4 sort of sits under C3. So I'm right there. And that's a paradoxical point. It shows up posteriorly, but it requires that we hold Cheryl flexion. So, and that should feel better. So I'm monitoring with my finger, and I pulled her into flexion. And here what I'm doing is, if you notice, I've got my elbow anchored in the table, and I'm using my arm as just a simple lever. So I'm using no muscular effort at all.
Are you on only one side?
What's that?
Are you on only one side?
I'm on the spinous process.
No, it's the other one.
Spinous process is the middle.
It's on the neck.
Spinous process. There's no sides. It's unpaired. Right? No. I said transverse for C2, but when I talked about this point, I talked about the spinous process. Yes? No, I didn't.
No, I think you said
Over here.
But it does.
Doesn't matter, that's correct.
Okay.
We clarify.
Yeah.
You have to go over there. It was just the index finger on the spinous process.
What's that?
Leave that finger in. Which finger was it?
Third finger. The only one that's actually touching your head.
The one that's touching.
That one. Yeah.
Oh, it's right there.
Yeah, there's the spinous process.
Oh, this one you...
And if I have trouble getting this to release, I would have her push back into my hand.
That's flexible.
Release. And push back. Release. The important thing here is that they're tucking their chin. You're using your elbow. You can't use your muscles to hold their head up this long, but you can just kind of lock the heel of your hand into her head and hold in by leaning into your elbow in the table.